Hey guys, this is my second video just today in this hour. We're going to talk about diabetes because I myself was very confused about different type of diabetes. I only knew about diabetes mellitus. I've heard about diabetes type 1, type 2, but I really had no idea about this word diabetes insipidus. So there's two different things. These are two different things, but we're going to take it one by one. We are going to talk about diabetes mellitus first. This is something that is most common and we all know about it. So it's basically diabetes mellitus, I'm going to call it DM, is a metabolic disease causing high blood sugar. I think that is something that we pretty much all know about it. And what we often think when we think of diabetes mellitus is pancreas not producing enough insulin. This is what basically we would know, from friends, family, somebody who has diabetes in the family. So just to clarify, what is insulin? Insulin is the pancreatic hormone. It's a hormone. Travels in blood. Signals the body cells to take up glucose or sugar, right? So diabetes mellitus, there's two types, right? We spoke about type 1. We spoke about type 2. So in type 1, number 1, this is an autoimmune disease. This one is not. Okay, this is basically coming from our lifestyle, obesity, etc., right? Now, another important thing is, we spoke in the last video what is autoimmune disease. So our body basically destroys the cells that produce that hormone, right? So in this case, so destruction of islets of Langerhans, which produces beta cells to produce insulin. And in this type 2, the cells in body have become resistant to insulin. Or can't effectively use insulin it makes. So this one, type 1, is also called juvenile onset or insulin dependent diabetes, whereas this one is insulin resistant diabetes. This one is type 1 is also a hereditary diabetes, affects only 5 to 10%. So type 2 is the one that's most common. The question also comes to our mind that eating sugar or eating too much sugar can cause diabetes. And the answer is no. Basically, it could cause weight gain or obesity, which may be a risk factor for diabetes. So the solution is switching to foods that have low glycemic index. Now that was all about diabetes mellitus, type 1 and type 2. Now we're going to talk about diabetes insipidus and maybe some difference between diabetes mellitus and diabetes insipidus. So diabetes mellitus, and this is DI for insipidus. So this one was type 1 and 2. This has no types. This is just diabetes insipidus. Diabetes mellitus is related to hormone insulin. And here the hormone involved is ADH, or antidiuretic hormone. In diabetes mellitus, the organ involved is pancreas, whereas in diabetes insipidus, the organ involved are kidneys. So along with the antidiuretic hormone, its receptor may also be involved. We understood diabetes type 1 and 2. We're going to talk a little bit more about diabetes insipidus. So, since it affects the kidneys, it could lead to kidney disease, and this is the most common reason of why people have kidney failure. The symptoms involved are frequent urination, which is also called polyuria, or even polydipsia. Which is excessive thirst. Just because these two are very common symptoms that are also involved with diabetes mellitus, one should not confuse diabetes insipidus and diabetes mellitus because they are two different things. So do not confuse yourself because of these two symptoms. Diabetes insipidus is 3 types. One is nephrogenic. Another one is central. And the third one is gestational. So nephrogenic is a disorder of water balance, can be hereditary, or acquired. So usually to treat it, diuretics are given. And it works by balancing calcium and potassium in the body. The central can only be managed but cannot be cured. To manage it, usually a synthetic hormone is given. It's called desmopressin. The next one is gestational, and we know that this is something that happens in pregnancy, and most women will not need any meds to control it after the birth of the child. And this is the same medication that is given to control the gestational diabetes insipidus, which is desmopressin, which is also given for central diabetes insipidus. So I hope that helps. So that the diabetes insipidus is basically a totally different disease than diabetes mellitus as a conclusion. I hope you have a great rest of the day.